Hello, everyone. My name is Natasha Trenev, and I'm the president and founder of ProTrend Precision Probiotics, the intelligent use of probiotics. I have been in this field for more than 60 years, and I started with my family's natural Bulgarian-style yogurt business in the mid-1960s. I set yogurt standards, kefir standards, and then in 1980s, I introduced the term probiotics, which now is a huge global business. Unfortunately, nobody really understands the use of appropriate probiotics to really recondition our GI tract so we can experience optimal health. So today's presentation is meant as my first learning management system to understand the role of probiotics in human health. Let's go. Our ProTrend Precision Probiotics and our GLP-1 learning management system is for your direct use. The digestive and metabolic collapse of our modern society is a huge problem. So why does modern disease begin in the gut? It certainly does. And the GLP-1 drugs are not solving this problem. They are really revealing it. For decades, we have been told that obesity, diabetes, and metabolic disease are the problems of calories, willpower, or genetics. But today, with the explosion of the GLP-1 drugs, we are witnessing something far more important. We are discovering that the real failure is not metabolic. It is digestive and microbial. The modern body is not really failing because it eats too much. It is failing because it cannot process, digest, regulate, and detoxify what it eats. And the GLP-1 drugs are not solving this problem. They are revealing it. The food system has outpaced human physiology. GLP-1 medications did not emerge because the human body suddenly forgot how to burn fat. They emerged because blood sugar regulation is broken, appetite signaling is distorted, satiety is disconnected from nutrition, and digestion has become dysfunctional. GLP-1 drugs are now being used to replace normal physiology instead of restoring it. This is not a medical triumph. It is a signal that normal digestive and metabolic physiology is no longer functioning properly in a large part of the population. So the human digestive system evolved over hundreds of thousands of years. Ultra-processed foods, synthetic additives, pesticides and herbicides, antibiotics in food and medicine, hormones in animal products, industrial seed oils, genetically modified crops. Our physiology never adapted to this. The result is not simply obesity. The result is a collapse of digestion, microbial ecology, immune signaling, and the metabolic order. Metabolic order is extremely important to understand. When we see these last 70 years, when we introduce these ultra-processed foods, synthetic additives, pesticides and herbicides, antibiotics in foods and medicine, hormones in animal products, industrial seed oils, and genetically modified crops, this is the result that we have. Okay, so let's talk about the most important concept that we have to understand from today. One of the most devastating changes in human health is something most people have never heard of: the disappearance of key human-associated microbes. For example, Bifidobacteria infantis, once dominant in healthy breastfed infants, now is nearly extinct in many Western populations. In fact, I have data that about 20, 25 years old that show that women in North America were not able to pass on these beneficial bacteria to their infants, even if they were vaginally born and breastfed. Only about 7% were capable of doing that. And now I don't have any current data, and I'm sure it's much worse. This organism, Bifidobacteria infantis, is essential for immune tolerance. Immune tolerance is one of the most important things that we can have for a developing infant. Training the immune system, preventing inflammatory disorders later in life. We did not simply lose bacteria, we lost biological programming. This is so devastating to all of us. And once lost, the entire digestive immune metabolic system is in disarray. It's this that we have to address in all of our pursuits. Okay, so what is the toxic load on the human gut? We often talk about antibiotics in medicine. But what we rarely discuss is the fact that glyphosate was patented as an antimicrobial. And many pesticides have antibiotic properties, which many people are not aware of. Animal feed contains antibiotics. Food residues contain antimicrobial compounds. This means humans are being chronologically exposed to low-grade antibiotic pressure every single day. Not enough to kill microbes outright, but enough to shift ecology, which means stress for resistant microbes, favor fungi and resistant organisms, destroy microbial diversity, and promote toxic fermentation instead of healthy fermentation. So the toxic load on the human gut. Undigested food does not become nourishment. So we are just not dealing with this properly. Modern humans are exposed to glyphosate and pesticides, ultra-processed foods, chronic antibiotic exposure, microplastics, which is another course in itself and what it's doing to our health, endocrine disrupting chemicals, chronic stress, and circadian disruption. We are not just overfed, we are underdigested. Most people are not sick because they eat too much. They are sick because they cannot properly digest what they eat. Undigested food does not become nourishment. It becomes toxic fermentation, endotoxin production, putrefactive compounds, immune triggers, neuroinflammatory signals. The modern epidemic is not one of excess calories. It is an epidemic of biological processing failures. So this is what we need to address in today's lecture. So we have a digestive collapse that is not just personal, it is generational. Parents with poor microbiomes. Now, one thing I want to say here, we have both the father's and the mother's unhealthy guts to deal with. If it's generational, let's say 2 or 3 generations back in either the mother's or the father's family, we're going to have problems. If both of them have problems, then we're going to have much bigger things to deal with. So parents with poor microbiomes, antibiotic exposure, inflammatory diets is a toxic burden, and they pass compromised microbial ecosystems to their children. We're now seeing children born with compromised digestion, immune dysregulation from infancy, metabolic dysfunction appearing in adolescence. This is not genetic. This is biological inheritance through microbial disruption. The toxic burden is not something we're dealing with effectively. So why is GLP-1 now necessary? GLP-1 drugs exist because the gut is no longer reliably producing metabolic peptides. Satiety signal is broken, glucose regulation is unstable, and digestive signaling is chaotic. So GLP-1 does not restore digestion, it bypasses it. It replaces what the gut can no longer regulate on its own. And this is why GLP-1 patients experience digestive side effects, because digestion itself was already broken before the drug ever entered the body. So we have chaotic digestive signaling. Unfortunately, we're not metabolically broken, we are digestively broken. This is the most important concept in this entire training. The body does not fail because metabolism fails first. Metabolism fails because digestion fails. Microbial ecology collapses, immune signaling destabilizes, neuroendocrine control becomes distorted. If you restore digestion, you restore metabolism, not the other way around. If digestion is the root of metabolic dysfunction, then weight loss is not your primary intervention. Appetite suppression is not your primary intervention. Digestive physiology is your primary intervention. GLP-1 drugs may suppress appetite, but only digestive rehabilitation restores health. And that is exactly where precision probiotic therapy becomes not optimal, but essential. Okay, so the gut as a 4-system organ. Why precision probiotic must be control physiology, not just add bacteria, including neuroendocrine signaling, immune integration, motility, fermentation, ileal brake, GLP-1 and PYY physiology, and why most probiotics, they ignore all of this. So modern disease begins with digestive collapse. GLP-1 drugs reveal dysfunction, they do not fix it. Microbiome is not optimal biology. Undigested food is toxic physiology. And if you want to restore digestion, you have to restore the proper metabolism. Okay, we want to go back and revisit this again. The gut is a four-system organ. And this is why precision probiotics must control physiology, not just add bacteria. And I'll repeat this again because this is so important for everyone to understand. This includes neuroendocrine signaling, immune integration, motility, fermentation, the ileal brake, the GLP-1 and the PYY physiology. And this is why most probiotics ignore all of this, because it's very difficult to do what we're going to tell you needs to be done. And it's not really difficult if you get your patient on a road to better health. So the gut is not a tube. The gut is a highly regulated multi-system command center. That's a great name for it, that coordinates digestion, immunity, hormones, and brain signaling in real time. If you treat it like plumbing, you will fail your patients. They're not going to get better. So the gut is a fourth system at once. The gastrointestinal tract is simultaneously a digestive organ, a neurological, a neuroendocrine organ, an immune organ, and an ecological system. This is something that you have to understand. It's not about fixing one thing. It's working in unison to fix the whole system in order to get your patient better. So the system one, the digestive organ, it requires proper gastric emptying, enzymatic breakdown, coordinated peristalsis, and time transit. And when digestion slows, this is what happens. Food putrefies, protein rots, carbohydrates ferment abnormally, toxic metabolites accumulate. And bingo, we have a big problem. So the GLP-1 and digestive failure. In a healthy gut, this may be tolerated. But in a fragile gut, which describes most modern patients, this creates food stagnation, toxic fermentation, endotoxin exposure, severe nausea, and bloating, which is not very comfortable if you've ever experienced it. So system number two, the endocrine organ. It communicates with the brain through GLP-1, peptide YY, serotonin, vagal signaling, immune mediators. And this is why nausea is a brain signal. Fullness can feel like sickness. Fermentation can trigger anxiety. Endotoxin can trigger depression. So GLP-1 drinks amplify gut-brain signaling, but without correcting digestion. They amplify distress, not health. And this is something we need to address. So the ileal brake, when too much signal, becomes a problem. The ileal brake is a powerful protective reflex. It slows digestion when nutrients reach the distal intestine, which means the end of the small intestine and possibly into the upper colon. The GLP-1 drugs overactivate this brake, so do many aggressive probiotics. The result, you have excessive slowing, you have increased pressure, you have increased fermentation, and you have increased nausea. And this is why many patients say, I took a probiotic and I felt worse. It wasn't the bacteria, it was the poor physiological design. System number three, the immune organ. Over 70%, some say over 80% of the immune tissue interfaces with the gut. Now remember, the normal gut is about 27 feet long. If you took out the small intestine, you could cover an entire tennis court. You got a lot of nooks and crannies in there where the immune tissue needs to communicate with the rest of the microbes in your gut, which is about 100 trillion. So when fermentation becomes toxic, endotoxins cross the barrier, immune cells get activated, and overactivation is not good, as we know. Cytokines increase and sickness behavior appears. This, we know, is not a good sign. So system number four, the ecological system. So the gut is really not a battlefield, it's an ecosystem. When you introduce random strains, high gas producers, aggressive colonizer, fermentation-heavy organism, you destabilize the whole ecosystem. And most probiotics are designed for marketing claims, not ecological balance. That takes years of research and knowledge to understand this. This is not something that you can understand immediately, no matter how many articles you read. So why more bacteria is the wrong goal. Health is not about adding bacteria. It's about restoring digestion, which is the most important process for human health, coordinating motility, reducing toxic fermentation, calming immune signaling, normalizing gut-brain communication. This requires functional strain selection, not CFU inflation. Each strain has a defined physiological role. So when you're introducing precision digestive control, this is where ProTren Precision Probiotics are fundamentally different. They are not a blend. They are a functional system designed to control digestion speed, motility coordination, fermentation intensity, immune and endotoxin load. Each strain has a defined physiological role. This allows something no other probiotic system can do. They can be titrated up or down based on the patient's real-time symptoms. And this is very important. Sometimes we have to take it down to even like a quarter of a teaspoon if a patient is too sensitive. And we have to do that because most people are uncomfortable with even good changes that happen in the body. And good changes do happen with our precision probiotics. So the functional division of labor, this is the foundation of a healthy digestive tract. So in the ProTren Precision system, one strain supports gastric digestion and proteolysis. That's our Lactobacillus bulgaricus. One strain supports small intestine ecology and motility. That's our Lactobacillus acidophilus. And one strain supports barrier integrity, immune calming, and toxin reduction. That's our bifidobacteria. But remember, these are just some of the benefits these bacteria produce. I've simplified it so it's not difficult for anyone to understand, but the amount of nutrient support and health support all three of these bacteria provide would take another course of possibly 2 hours to explain fully. So this is just a very short summary. So this is not accidental. It mirrors human digestive physiology. This is very important to understand. It's not about just throwing in bacteria. We need to mirror human digestive physiology. Okay, so why does titration matter? And this is crucial. Every patient gut is different. Every patient's composition of microorganisms is unique to each person as their fingerprint. This is very important to understand. Each person is unique. So you have to understand that each person may react differently. And it's not hard to titrate up and down because we've made it easy for you to do. So every patient gut is different. So the motility differs, fermentation differs, immune reactivity differs. A system that cannot be adjusted will fail your patient. ProTren protocols are designed so practitioners can increase digestion without increasing gas, calm fermentation without stopping motility, support immunity without overstimulation, adjust in response to constipation or diarrhea. Symptoms become guidance, not obstacles. This is very important to understand. Each person may react differently. It's their perception of reality that has a lot to do with how these bacteria respond to each individual. So we have a lot of things to consider when we're talking about titration and matching each person's individual needs. So the GLP-1 Precision Probiotics microbiome support, modified to the ProTren system. This protocol is not symptomatic probiotic stacking. It is a sequential strain-specific microbial support designed to protect the upper GI function, normalize intestinal transit, reduce inflammatory signaling, and preserve patient adherence to GLP-1 therapy. This is very important. It's very difficult to adhere to a therapy if you're going to be sick to your stomach 24/7. So the GLP-1 Precision Probiotics microbiome support. And this is a continuation. These are just recommendations. This is the beauty of our product. We tell people, have your patients, put it in the fridge. We'll come back to higher dosing and frequency as we progress. So during the GLP-1 use and for the first 15 to 30 days post-therapy, we use our Bulgaricum product, which is a specific strain of Lactobacillus delbrecki subspecies bulgaricus, and I call the strain LB51. This is part of the bacteria that is found in yogurt, and it's been around for centuries, and it was touted as the Bulgarian recipe for longevity by no one minor than Dr. Mechnikov, who was a fellow at the Pasteur Institute in Paris at the turn of the 20th century. So this is very important. This has been in the literature for decades, and people ignore it because this is a difficult bacteria to deal with. That's why they don't want to bother, not because it's not great, but because it's difficult to deal with. So the purpose of this bacterium is the upper GI conditioning and gastric tolerance, motility signaling. So we start, this is a recommendation, remember, 2 capsules before each meal 3 times a day. Make sure you drink it with at least 6 to 8 ounces of unchilled, filtered, warm water is preferable, but unchilled is acceptable. Why? Because we want to wake up the bacteria. We don't want to take cold water that's not going to wake them up. We want them to start working the minute we swallow them. That's why we recommend this. Okay, so the GLP-1 Precision Probiotics Microbiome Support. Here we have Bulgaricum, Lactobacillus bulgaricus, Delbrueckii subspecies. And so the rationale. So what is the precision logic? L. bulgaricus is uniquely adaptive to survive low pH and bile, supports stomach and proximal small intestine function, helps counter GLP-1 induced gastric status without stimulating excessive motility. Reduces nausea, bloating, and early satiety without interfering with appetite signaling. This is not a yogurt culture. This is a human-compatible, clinically deployed strain selected for hostile GI environments. This is, like I said, a very, very good probiotic bacteria because one of its unique features is the ability to break down proteins. Proteolysis is a very important function. So the GLP-1 Precision Probiotics Microbiome Support. So we then include 2 Trenev Trio, which is a multi-strain precision foundation, has 3 bacteria, one for the small intestine, one for the large intestine, and one for the transient flora, which is the Bulgaricus. And it's important in every aspect of human health. So we recommend as a starting amount is 1 capsule in the morning and 1 capsule in the evening. This can be changed to suit the person's individual needs. We want to make it comfortable for every patient. And the Precision Probiotics Microbiome Supports continued. So we have 2 Trenev Trio Multi-Strain Precision Foundation. So what is the purpose of using the Trenev Trio? It's to maintain microbial diversity during pharmacologic stress, support mucosal immune signaling, prevent downstream dysbiosis as gastric emptying is altered. So here's a clinical note for all of you. This serves as the microbiome anchor, not the workhorse. So we go then with if diarrhea occurs despite initial loading. So step 1, week 1, Superdophilus, 1 capsule, 3 times a day. This is my super Lactobacillus acidophilus NAS strain or DDS1 strain. It's practically the same. And 1 Bulgaricum. So we can reduce this to 1 capsule 3 times a day. Note that we can reduce it, the frequency and the amount to suit the patient's need. We just tell them, don't throw it out, keep it in the fridge, you'll come to the optimal dosing. So step 2, if unresolved after 7 days, discontinue the Bulgaricum and take the Superdophilus 2 capsules 3 times daily before meals. Again, please always use filtered, unchilled water, preferably warm water. And here's the rationale. Diarrhea reflects lower intestinal imbalance, not gastric dysfunction. Lactobacillus acidophilus, the NAS strain, is dominant therapy, stabilizes stool consistency and epithelial integrity. This is very important. Removing Bulgaricum prevents overstimulation in sensitive patients. So some patients are so sensitive, even if it's good for them, we have to go easy because we want to normalize their function and not cause too much discomfort. And here's some important clinical instruction. It's often missed. Limit liquid intake with meals, which I think a lot of you know. Excess fluids and GLP-1 therapy can further delay gastric emptying and worsen nausea, reflux, and bloating. So we sort of have to work with the body, and each one of us has an individual challenge. These are going to be all available for you, all of this use, and you can always talk to one of our wonderful probiotic specialists that will help you if you have an individual question. That's a wonderful service only ProTren Precision Probiotics will provide for you and your patient. Finally, Trenev Trio, 1 capsule a day. This is maintenance and resilience. Restore long-term microbiome balance, support metabolic resilience after pharmacologic weight loss intervention. It's very important to keep this normal because anytime you lose weight, gain weight, have some alteration, it changes the whole microbiome, and people don't understand this. I do because I've been dealing with this for so many decades. And what makes this your system? This is strain-specific medicine, not CFU marketing. Each organism has a defined role and anatomical target. Adjustments are based on patient response, not protocol rigidity. Designed to support GLP-1 therapy, not compete with it. It's built on decades of human strain probiotic clinical experience, not trend-driven blames. This is so important, guys, so important. The takeaways. If you take away something, take away this. The gut is a four-system organ. GLP-1 amplifies existing dysfunction. Toxic fermentation is the real enemy. Most probiotics ignore physiology. Precision probiotics give you the chance to titrate and get clinical success with each and every patient. This is so important, extremely important. And so you have your nutritional support. I'm not going to go through all of this. This is, available to all of you. We provide clinical support during and post-therapy, and we can adjust this to every patient's needs. This will be made available to anyone who calls us and requests it. We'll make it available to you in any way that's feasible and easy for you to obtain and use. If you don't want to go through this whole thing, here's a quick reference guide, which is also available to you. So remember, the Trenev Trio remains constant across all protocols. So one capsule in the morning and one capsule in the evening. This is for the entire balance of the 27 feet of GI tract. So how your gut naturally produces GLP-1. Here's an option for those who don't want to give the GLP-1 therapy to their patients. A certain beneficial microbes and their fermentation products, short-chain fatty acids like butyrate and propionate, they stimulate the L cells to release more GLP-1 and peptide YY. This is a natural process that offers powerful benefits, including improved insulin sensitivity, enhanced gut barrier function, and better appetite regulation. However, in a motility-fragile gut, the same beneficial process can lead to increased fullness, bloating, pressure, and nausea. This explains why some people feel worse on good probiotics when their motility isn't yet stable. And that's why you can change the amount and the frequency. We're the only ones that offer this. Again, just for your takeaway, so indirect small chain fatty acid production, it powerfully increases the short chain fatty acid production through natural fermentation pathways. L cell support supports L cell stimulation and physiological GLP-1 and peptide YY release. It's an ileal brake strength system, strengthens the natural ileal brake signaling for optimal metabolic control. And here's the protocol in a nicely presented fashion. You can have any of these for your use in your clinic. And I invite you to please call us at this number, ask for one of our probiotic specialists. All of my people have been with me for more than a decade, some for 2 decades. They love their job. They've helped thousands of people. We want you to be part of our family and help your patients. And by the way, I have dedicated my life to helping each and every individual get better. And it's so important to understand that fixing the gut will help the individual overcome major problems and have a healthy, happy, normal, and productive life. I welcome your questions, and I'm here to help each and every one of you if you need me. Thank you for listening today.